Hello again. We continue talk about clinical immunology, part 2, and start from question to consider. How can the immune system detect invasion by pathogen and alert the immune system? Next question is discussing, can the immune system use pathogen profile as a quick and dirty way to differentiate a pathogen from self-antigen? How does the immune system contain pathogen? How are immune system directed to sites of infection? If you bite your fingernails, have you ever got an infected from biting? It exactly. It happens all the time. How do you know it's infected? What are the signs? It hurts, painful, swollen, red. Pain formation resulted in increased permeability, increased the vascular diameter. Redness and heat increasing blood flow and decreasing blood flow velocity or speed. Swelling increases result in increased permeability vessels. Blood leaves the capillaries into the tissue. If capillaries are sealed, they can't do that. And then it just goes away 1-2 days by itself. We don't need to take antibiotic, no need to do anything more, because your innate immune system is being very effective at containing its response. Which causes inflammatory? Of course, bacteria replication, they tend to damage tissue and mobilize inflammatory response to repair the tissue damage. The major cells is macrophages. Their recruitment of these cells to the local area of infected. What is the goal immune system, immune response? What does it want to accomplish? First, prevent the initial establishment of infection, prevent spread of infection from invasion site, recruit effector cells for assistance, and alert and mobilize T and B cells. So, innate immune response to have multiple layers. The happy end of this reaction is removal of infection agent. Innate immunity starts from initial infection to 4 hours. This results from infection areas. Functions for recognition by performed non-specific and broadly specific effectors, and removal of infection agent. If the smaller or more infected areas or more spread areas early induced phase innate response continue to 96 hours up to 4 days, resulting in infection, recruitment of effector cells, recognition of pumps. Pumps, it's pathogen associated molecular patterns, activated of effector cells and inflammation, and is a result intend removal to infection agent. Adaptive immunity response start later, more than 4 days and 96 hours, result in infection transport of antigen to lymph nodes, lymph organ, peripheral organ, recognized by naive B and T cells. And this result clonal expression and differentiation to effector cells. It's resultant to removal of infected agent from infected areas. Innate immunity and adaptive or acquired immunity, there are different stages. Specific defense and non-specific defense. First line defense and physical barrier, it's skin, mucous membrane, and another mucous stomach for respiratory tract, so on. Chemical barrier, antimicrobial substance in the blood fluids as oxygen, as ferritin, and in other oxidant molecules, such as in mucous membrane, it's saliva, teeth, and gastric juices. This is a result to stop infected before it enters the body, hence called as the first line of defense. Secondary line of defense, cellular, if bacteria pass into the body. This initiated cellular defense, phagocytes, neutrophils, basophils, eosinophils, and macrophages. First barrier, it's phagocytes and macrophages have special factors, very sophisticated cells, as dendritic cells and the Langerhans cell. Neutrophils, its first cells appear in infected areas. Neutrophils have special oxygen, chlor minus molecules, myeloperoxidase enzyme, this formation respiratory burns bacteria. Basophils, eosinophils involve as a inflammatory response and allergic reaction too. Eosinophils have a lot of release factor as interleukin and as histamine, heparin, desoxyribonuclease, ribonuclease, again virus infection. Histamine and heparin tend to permeability vessels and accomplishment redness and swollen in inflammatory place. It's very important, and allergic reaction too. Blood and lymph system, all of them involved to secondary line of defense. Molecular defense, a lot of lymphokines, interleukins, chemokines, and etc. And this dangerous microorganism. In acquired immunity, lymphocytes, third line of defense, activated T cells mediate immunity, and B cells humoral immunity, cells produced antibody to fight foreign microorganism. Next, macrophage. Discuss about macrophage, very important cells with dendritic and Langerhans cells. Macrophages have receptor. Between them, it's important glucan receptor, mannose receptor. Glucan and mannose protein have bacteria in cell wall. Our cells don't have glucan and mannose too. Lipopolysaccharide gram-negative bacteria recognized. Toll-like receptor discovered in 1996 year as bacteria, virus, and fungi recognized. Activated macrophage juncted with toll-like receptor. This is resulted activated transcription factor NF-kappa B, which many of you have heard. Activated a whole and FKB. Activated interferon alpha allows the cells to basically protect itself. Toll-like receptor can be activated by virus. Activated interferon, I mentioned this one. Which type interferon do we have? Types of alpha production: leukocytes interferon produced by virus-infected leukocytes. Beta interferon produced fibroblast interferon produced by virus-infected fibroblast or epithelial cells. And gamma immune interferon produced by certain activated T cells and natural killer cells. Langerhans cells provide a link between the innate immune system and adaptive immune system. Immature dendritic cells that are present in the skin, after activated, they migrate to lymph nodules and transport skin-derived antigen. In the lymph nodules, they become activated dendritic cells. In the lymph nodules, dendritic cells and activate antigen-specific lymphocytes. These cells are anyway the innate immune system activated, the adaptive immune response. Interleukin 6. Interleukin 6 produced by monocyte activated by bacteria stimulate the liver to produce factor that bind to pump as pump its pathogen associated molecular patterns. Interleukin 6 release from liver and formation acute fast protein as acute fast protein according to C-reactive protein, amyloid protein, and another protein, acute fast protein. Fibrinogen is a formation as a C-reactive protein as a opsonin and activated result complement, activating complement, and activated brain hypothalamus. This is result from increasing temperature or fever, and hyperalgesia. Monocytes activated by bacterial secrete cytokines that amplify the immune system. Which kind of cytokines is produced? Interleukin 1 that respond to fever, interferon alpha, tumor necrosis factor alpha, and interleukin 6, interleukin 17 as result in inflammatory response. If too much tumor necrosis factor alpha may release may cause septic shock and death. As a result, we prescribed inhibitor tumor necrosis factor as a glucocorticoid and antagonized tumor necrosis factor monoclonal antibody. This picture displayed about normally concentrated monocyte in normally concentrated in blood stream up to 10% and more higher concentrated monocytes. Monocytosis may be occur first of all virus infection Epstein-Barr virus and another herpetic group, and tuberculosis infected, and another disease maybe again. Very important now about adhesion molecule. These molecules expressed by epithelial cells bind to other adhesion molecules expressed by inflammatory cells. Between them, there are two types: selectins, some molecules, intercellular adhesion molecules, initiate leukocyte-activated endothelium and platelet cells. This resulted adhesion to blood vessels and penetrated between endothelial cells and pass into tissue. Adhesion molecules, two types called integrins, bind to cells adhesion and expressed extracellular matrix, monocytes, T cells, macrophage, neutrophil, and dendritic cells, and present as a LFA. That's a lymphocytes function associated antigen. Infected tissue produce interleukin 8 and express adhesion molecules to recruit phagocytose into infected tissue. Infected tissue produce interleukin 8 and express ISAM as adhesion molecule, and interleukin 8 induced alpha A1 and selectin molecules on pathogens. Alpha A1s bind to ISAM and phagocytes and into interstitial tissue. And formation diapedesis into inflammatory place. Next discussion we continue next topic lecture, 3-part lecture, clinical immunology. See you later.